looking at epilepsy, and it is a condition that affects 70 million people worldwide. It also costs Australia more than $12 billion annually. What we are seeing is that whilst anti-seizure medications help 2/3 of patients become seizure-free, in Australia, more than 30% of patients are not immediately treated at diagnosis. As a medical student, what I want to find out with my research is whether this is just a benign reflection of clinical decision making with minimal long-term consequences, or if it is actually reflective of a treatment gap which leads to increased mortality and increased morbidity for those patients with delayed and no treatment in the long run. So for my research, we linked the clinical records of over 3,000 patients seen in first seizure clinics to Department of Health databases which contain extensive information on over 100,000 admissions, ED presentations, psychiatric visits and deaths. We then compared the outcomes of patients who were immediately treated to those patients who received delayed or no treatment, and we investigated to see if there were any differences in mortality, morbidity, healthcare utilization, and healthcare costs between epilepsy patients receiving immediate treatment and those receiving delayed or no treatment. By tracking a cohort of confirmed epilepsy patients over a span of 10 years, our study will offer one of the most comprehensive reviews of delayed treatment and no treatment among newly diagnosed epilepsy patients. This is especially crucial given the larger than expected proportion of untreated epilepsy patients that we discovered in Australia. This research also has direct clinical implications, as starting a newly diagnosed epilepsy patient on anti-seizure medications or not is a common dilemma encountered by many clinicians. It is also a dilemma that I have witnessed firsthand as a medical student attending Alfred's epilepsy clinics. Ultimately, the research can also pave the way for future health economic analysis and ultimately inform clinical decision making in the world of epilepsy.